we are working across government and across the scientific and medical community to move us out of this pandemic, to stop the spread of infection, to keep people out of the hospital, and to save as many lives as possible. This afternoon, I will talk with you about vaccine booster shots, but first I want to reflect on where we are in the current state of the pandemic. Yesterday, CDC reported over 120,000 daily COVID-19 cases, nearly 10,000 hospitalizations, and almost 2,000 deaths. The vast majority of these cases and deaths reflected in these reports are people who are unvaccinated. Vaccination provides the best possible protection against COVID-19 infection, severe disease, hospitalization, and death. CDC data continue to show the power of vaccination, with recent reports showing a 5-fold reduction in the risk of infection, 10-fold reduction in the risk of hospitalization, and 11-fold reduction in the risk of death after vaccination. Yesterday, we took an important first step in our vaccine booster program. As part of the process over the past few days, CDC's Advisory Committee on Immunization Practices met to discuss the FDA emergency use authorization of booster doses of the Pfizer-BioNTech COVID-19 vaccine. They met, as they often have during this pandemic, in a moment of great importance of health to many Americans, analyzing the complex real-time data available to make concrete recommendations. Their task was not easy, and their resulting hours-long discussion reflected the tension of the moment between an individual calculation of risk and benefit and the impact on society. I listened intently to all of it. I heard a diversity of opinions and perspectives, and I applaud the committee's commitment to an open and transparent scientific process. Following their vote, I fully endorsed ACIP, the committee's recommendations that all people 65 and older and those 50 to 64 years old with underlying medical conditions should receive a Pfizer booster shot if they received a Pfizer primary series. I also endorsed their recommendation to allow 18 to 49-year-olds with underlying medical conditions to receive a Pfizer booster shot. These recommendations will help strengthen protection against severe disease in those populations who are at high risk of severe complications from COVID-19. At the conclusion of the meeting, the advisory committee had a robust discussion about whether boosters should be available for those at high risk of COVID because of occupational or institutional risk. People like healthcare workers, teachers, frontline responders, essential workers, and those in congregate settings. The result of their discussion was a close vote. Had I been in the room and on the committee, I would have voted yes. And that is reflected in my resulting decision to allow the use of Pfizer-BioNTech COVID-19 booster dose for those 18 and older at high risk of COVID-19 exposure and transmission because of occupational and institutional exposure. As CDC director, it's my job to recognize where our actions can have the greatest impact. In a pandemic, we most often take steps with the intention to do the greatest good, even in an uncertain environment. And that is what I'm doing with these recommendations. Over the past 18 months, we have experienced a deadly pandemic that has had a disproportionate impact on parts of our country. Those on the front lines, in hospitals and classrooms, and those in crowded settings who have put themselves in harm's way on a daily basis. In an effort to protect those at greatest risk, our initial vaccine rollout prioritized these individuals, the everyday heroes of our society. Our healthcare systems are once again at maximum capacity in parts of the country. Our teachers are facing uncertainty as they walk into the classroom, and I must do what I can to preserve the health across our nation. I'm also aware of the disproportionate impact this pandemic has had on racial and ethnic minority communities. Many of our frontline workers, essential workers, and those in congregate settings come from communities that have already been hardest hit. Withholding access for boosters from these people and communities would only worsen the inequities that I have committed to fight against. When we announced our booster plan in August, we said we would follow the regulatory and scientific processes, and over the last month, we have done exactly that. Scientists at FDA, CDC, and across the country and the world have pored over the data we have available. FDA's decision to authorize the Pfizer-BioNTech COVID-19 vaccine for those greater than 65, those at high risk for disease because of underlying medical conditions, and those at high risk of exposure and transmission because of occupational and institutional risk, reflected a balance of the safety and effectiveness data we have available and the need to protect our society. It was a decision about providing rather than withholding access. I too thought of the stressors of the current moment of this pandemic and the principles of access and equity in my decision. CDC is making boosters available to these eligible groups, and we will look at the data. We want to ensure people have the choice to take advantage of a tool that may be helpful to optimize their vaccine protection as the Delta variant continues to circulate and many face increased risk. The interim guidance is for Pfizer booster vaccines for COVID-19. It is a first step, and we will continue to review new data on effectiveness and experience with the third shot as it becomes available. We suspect that we are seeing with existing data for older people and those at greatest risk of severe outcomes or occupational exposure will not be unique to only those populations. I'm committed to updating and revising our guidance in real time and in collaboration with the scientific community. Over the past 2 weeks, ACIP, our advisory committee, and FDA only reviewed data for the Pfizer-BioNTech vaccine. CDC will continue to monitor the safety and effectiveness of COVID-19 vaccines to ensure appropriate recommendations to keep all Americans safe. We will, with similar urgency, evaluate the available data in the coming weeks to swiftly make additional recommendations for other populations at risk and people who received Moderna and J&J vaccines. While today's action was an initial step related to booster shots, it will not distract us from our most important focus, to get as many people as possible vaccinated with a primary series. I want to be clear, we will not boost our way out of this pandemic. Infections among the unvaccinated continue to fuel this pandemic, resulting in a rising number of cases, hospitalizations, and deaths where people are unvaccinated. The most vulnerable are those unvaccinated. If you are not vaccinated and eligible, I encourage you to get vaccinated to protect your community, your family, and yourself. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. Dr. Walensky has very clearly delineated the recommendations for a third shot booster for people who've received the Pfizer regimen. What I'd like to do over the next few minutes, as shown on this first slide, is to try to answer the question, is what the third shot booster of the mRNA vaccines do for both immune response and clinical effect. So let's first look at the immune response with regard to neutralizing antibodies. On this slide, this is what the booster does for neutralizing titers against the Delta variant. In green is the wild type variant. For comparison, in blue is the Delta variant. And you're looking at different age groups, 18 to 55 and 65 to 85. Just concentrate for a moment on the blue. 1 month after dose 2, the titer was 241. It went up dramatically after dose 3 to 1,321. If one looks at the 65 to 85, it went from 123 to 1,479. That's laboratory data. Let's look at clinical data. Next slide. This is a study that was recently published in the New England Journal of Medicine, again in Israel, from 1.14 million people aged 60 years or older who'd received a second dose of mRNA at least 5 months earlier. 12 days or more after the third shot booster dose, the rate of confirmed infection was lower in the booster group than in the non-booster group by a factor of 11.3. And the rate of severe illness was lower by a factor of 19.5. Let's take a closer look at that in that paper. Next slide. As you can see, going from left to right are the days since the booster vaccination. And as you can see, somewhere around 12 days from that third shot booster, you see an increase in protection against confirmed infection in the booster group compared with the non-booster group. Next slide. What about severe disease? Here again, in a study from Israel in individuals age 60 or older in a per 100,000 population. On the left part of the slide, unvaccinated in red, those who have 2 doses of the mRNA, 37, compared to those who got 2 doses plus the booster, down to 4. This is more dramatically demonstrated on the right-hand side of the slide when you look at the months of infection with severe disease, 175 unvaccinated, 37 of the people who got 2 doses, and 4 with those who got the 3rd boost. Next slide. What about reactogenicity? The kinds of effects you get when you get an injection of a vaccine. As shown, highlighted in yellow, in this observational study of over 1,600 individuals, again in Israel, the local and systemic reactions following the 3rd dose were similar to those reported following the 2nd dose, which is always more than the 1st dose, but quite similar following the 2nd dose. Next slide. To reiterate what Dr. Walensky said, we're talking about boosters, but the fact is it's still extremely important for the unvaccinated individuals to get vaccinated. And as Dr. Walensky said, I will repeat it because it's worth repeating. After Delta became the most common variant, a fully vaccinated person had a reduced risk of infection by 5-fold, hospitalizations by greater than 10-fold, and death by greater than 10-fold. With that, I'll hand it over to Dr.